بسم الله الرحمن الرحيم. اليوم بنبدأ المحاضرة الثانية في مادة الأناتومي المرحلة الثانية حول موضوع face. Face in general is the front of the so the face is the mirror of the mind. That is said by St. Jerome, that the mind of any person by the face of the face is a part of front of the head between the ears and from chin and to the hairline, or where it's out to be. So the front of any head is the face that begin from upside down from the hairline of the face to the chin area from down, and from ear to ear from the side to side. The part of the face is from forehead and from the eye, nose, cheek, mouth, and the last part in our side is the chin. The face begin divided to three parts: the upper third, middle third, and lower third. The upper third is the forehead, is common to both the face and the scalp. The forehead is returned to the face and returned to the scalp. The skin of the face possesses numerous sweet and sebaceous glands, is varies in thickness, and is very thin on the eyelid. It is connected to the underlying bone by loose connective tissue, in which are embedded the muscles of expression. No deep fascia is present in the face, only superficial fascia beneath the skin, and beneath it the muscle of facial expression and the bone. We have wrinkles line of face result from repeated folding of the skin, perpendicular to long axis of underlying contracting muscle, coupled with the loss of youthful skin elasticity. Surgical scars of the face are less conspicuous if they allow the wrinkle line. The wrinkle line, due to the contraction of a facial muscle of facial expression beneath the skin, so leave this line. The incision must done within the wrinkle line to not cut any collagen fiber, to we have no any scar present in the face, and the face is the mirror of any person. The innervation of the face, we have sensory innervation, and the most important sensory innervation of the face, the skin and the eye and the nose and mouth and the chin. So the skin of the face is supplied by branches of three divisions of the trigeminal nerve, fifth cranial nerve, except for a small area over the angle of the mandible and the parotid gland, which is supplied by greater auricular nerve from cervical 2 and cervical 3. This area is a small area not supplied by trigeminal nerve. These nerves not only supply the skin of the face, but also supply proprioceptive fiber to underlying muscle of facial expression. Only not the skin, the underlying fascia, and the muscle of facial expression is sensory innervation by the trigeminal nerve. We have three divisions of trigeminal nerve. The first division is the ophthalmic division, the second division is the maxillary division, and third division is the mandibular division. The first division is ophthalmic nerves, supply the skin of the forehead, the upper eyelid, the conjunctiva, and the side of the nose down to and including the tip of the nose is by the ophthalmic nerve. The branches of the ophthalmic nerve that supply the forehead is the lacrimal nerve. This nerve branch of the ophthalmic division of trigeminal nerve supplies the skin and conjunctiva of lateral part of upper eyelid. The second branch is the supraorbital nerve, went around the upper margin of the orbit at the supraorbital notch, which divide into branches that supply the skin and conjunctiva on the central of the upper eyelid and the skin of the forehead, is by a branch of supraorbital nerve. The third branch, more medially to the supraorbital nerve, is the infratrochlear nerve, when around the upper margin of the orbital medial to the supraorbital nerve, which divided into branches that supply the skin and conjunctiva on the medial part of the upper eyelid and the skin over the lower part of the forehead close to the median plane. So bilaterally to the supratrochlear nerve, right and left supply the middle part of the forehead. The fourth branch of the ophthalmic division of trigeminal nerve is the infratrochlear nerve. This leaves the orbit below the pulley of the superior oblique muscle, which supply the skin and conjunctiva on the medial part of upper eyelid and the adjoining part of the side of the nose by infratrochlear nerve. The last one is the external nasal nerve. Leave the nose by emerging between the nasal bone and the upper nasal cartilage, which supply the skin on the side of the nose as far as the tip of the nose by external nasal nerve. This division from ophthalmic division of trigeminal nerve is by red in color. Now, the second division is maxillary division of trigeminal nerve is blue in color. This supplies the skin on the posterior part of the side of the nose, the lower eyelid, the cheek, the upper lip, and the lateral side of the orbital opening. This division divided to branches. The first branch is the infraorbital nerve, is a directed continuation of maxillary nerve. It enters the orbit and appear on the face through infraorbital foramen. It immediately divided into numerous small branches which radiated out from the foramen and supply the skin of lower eyelid and cheek and the side of nose and the upper lip by infraorbital nerve. The second branch, the facial nerve, passes onto the face through the small foramen on the lateral side of the zygomatic bone. It supplies the skin over the prominence of the cheek. The other branch is the temporal nerve, emerged in the temporal fossa through a small foramen on posterior surface of the zygomatic bone. It supplies the skin over the temporal area to the side of the skull. This is the blue one is the maxillary nerve of that have branch of trigeminal nerve. The third branch of trigeminal nerve is the mandibular nerve, is the green in color. The mandibular nerve supplies the skin over lower lip, the lower part of the face, the temporal region, and part of auricle. It then passes upward to the side of the skull, by the mandibular division of trigeminal nerve. The branches of this division is the first, the mental nerve, emerge from mental foramen of the mandible and supply the skin of lower lip and chin. That is the terminal branch of the mandibular division of trigeminal nerve. The second branch is the buccal nerve, emerged from beneath the anterior border of masseter muscle and supply the skin over a small area of the cheek beneath the mandibular division, maxillary division of trigeminal nerve is the buccal nerve, a branch of the mandibular division of trigeminal nerve. The last one, the auriculotemporal nerve, ascends from upper border of parotid gland between the superficial temporal vessel and the auricle. It supplies the skin of the auricle, the external epidermis, the outer surface of tympanic membrane, and the skin of the scalp above the auricle by the auriculotemporal nerve. This figure shows the branching of the ophthalmic, maxillary, and mandibular division. The red one is V1, ophthalmic division, that have the supraorbital nerve, supratrochlear nerve, the temporal nerve. From the second division, the maxillary division, and we have the facial nerve, and we have infraorbital nerve and buccal nerve. And the mandibular division, we have the auriculotemporal, mental, and buccal nerve of the supply the face, except the angle is white in color by C2, C3, that a greater auricular nerve. The blood supply and drainage, the arterial blood supply of the face The face receives a rich blood supply from two main vessels, the facial and superficial temporal artery, which are supplemented by several small arteries that accompany the sensory nerve of the face. The same artery is the same as the nerve of the facial supply of the forehead, middle third, maxillary area, and mandibular area. The facial artery is the arise from external carotid artery, branch of the external carotid artery, having reached upward and over the submular salivary gland. It curves around the inferior margin of the body of the mandible at the anterior border of masseter muscle. It runs upward in tortuous course toward the angle of the mouth and is covered by platysma and the rhizorus muscle. It then ascends deep to zygomaticus muscles and levator labii superioris muscle and run along the side of nose to medial angle of the eye, where it anastomosis with the terminal branch of ophthalmic artery with the infratrochlear artery. This artery is tortuous in shape, not straight, due to the movement of the mandible, so stretching of the artery not we have any tear to the artery. So it is have a larger in size than is normal in the face. The branching of facial artery. The submental artery arises from the facial artery at lower border of the body of the mandible that supply the skin of the chin and lower lip. The inferior labial arteries arise the angle of the mouth and run medially in lower lip and anastomosis with its follow of the opposite side from the right to left side. The superior labial artery arises the angle of mouth. It runs medially in the upper lip and gives branch to the septum and ala of the nose beside to the upper lip. The lateral nasal artery arises from facial artery alongside the nose. It supplies the skin on the side and dorsum of the nose. The second artery that supplies the face is the superficial temporal artery, the smaller terminal branch of external carotid artery. The external carotid artery branch to at the end branches of it to the maxillary artery and the superficial temporal artery. The maxillary artery is the larger branch that runs behind the mandible and go inside in the base of the skull. But the superficial temporal artery is a smaller one that comes in the parotid gland. It ascends in front of auricle to supply the face and the skull. The branching of the superficial temporal artery, the first branch is transverse facial artery. A branch of superficial temporal artery arises within the parotid gland. It runs forward across the cheek just above the parotid duct and supply the cheek area. We have two branching, the supraorbital and infratrochlear artery. Branch of the ophthalmic artery supply the skin of forehead. This two branch not from superficial temporal or from facial artery. It is from internal carotid artery that give a branch is ophthalmic artery. This branch of ophthalmic artery, the terminal end is the supraorbital infratrochlear artery that supply the forehead, like the supraorbital and infratrochlear nerve. The venous drainage of the face. The venous drainage is the return of the blood from the arterial capillary to venous capillary to the vein to the heart. Is the same as the artery and the nerve of the face. The facial vein is the major vein that drains the blood from the face. It is formed at the medial angle of the eye by union of the supraorbital and infratrochlear veins. It is connected to the superior ophthalmic vein directly to the supraorbital vein. By means of the supraophthalmic vein, the facial vein is connected to the cavernous sinuses. This connection is of greater clinical importance because it provides a pathway for the spread of infection from the face to the cavernous sinus. This communication between the supraorbital vein and the superior ophthalmic vein go to the venous axis. Any infection in this dangerous triangle got passed through to the cavernous sinus and lead cavernous sinus thrombosis and may lead to death of the person. The facial vein, its course descends behind the facial artery to lower margin of the body of the mandible. It crosses superficial to the submandibular gland and is joined by anterior division of retromandibular vein. The facial vein ends by drainage into internal jugular vein. Its connection between the facial vein and the anterior division of retromandibular vein that go are drained to the internal jugular vein. The facial vein receives tributaries that correspond to the branch of facial artery, is joined by pterygoid venous plexus by deep facial vein, and to cavernous sinuses by supraorbital ophthalmic vein. The transverse facial vein joins the superficial temporal vein within the parotid gland. The two veins, the transverse vein from the side of the cheek to the within the superficial temporal vein from the side of the scalp and joining, forming a retromandibular vein. The lymphatic drainage of the face. You have many lymph nodes within the head and the face. We have superficial lymph node and deep lymph node. The superficial lymph node that form a circle around the head that have in the face we have parotid periauricular lymph node, buccal lymph node, submental lymph node, and submandibular lymph node. This is superficial lymph node. This superficial lymph node that have drained is lymphatic drainage to deep cervical lymph nodes. The lymph from forehead and anterior part of the face drain into submandibular lymph node. A few buccal lymph nodes may be present angle of the course of these lymph nodes. The lateral part of the face, including the lateral part of eyelid, is drained by lymph vessels that end in the parotid lymph node. The central part of lower lip and the skin of the chin are drained into submental lymph nodes. Thank you for listening to this lecture and continue with the facial muscle of expression.